Welcome back to KATV here at noon. March is International Women's Month, and more than ever, it's important for all women to pay attention to their health. That means regular gynecological visits. Joining me now is Dr. Megan Culotta from CHI Health. Megan, thank you so much for joining us today.
Thanks for having me.
We'll start now with, we talk about how important it is for women to have an ongoing relationship with their health and their health providers, not just during pregnancy, but also throughout their lives, right?
Yeah, I think it's really important. I think for a lot of women, we know that we need to go see the doctor when we're pregnant and having a baby, but there's so much more to women's health and to gynecologic care. So I think it's really important that everyone have a provider that they feel comfortable and safe with, who they can see throughout their lifespan.
And many women, when they think of their annual visit, they think of maybe just a pap smear, but there's so much more involved. Can you walk us through what a comprehensive women's health check looks like when they are coming in to see you guys?
Absolutely, yes. A pap smear is very important, but it's just one part of what we do. A lot of our annual exam is really just talking with our patients and helping them understand how their health is, where we can optimize their health, making sure that we're doing all of the appropriate cancer screenings for them, things like screening for breast cancer, colon cancer, cervical cancer. So it's a lot of talking and a lot of figuring out where we can optimize their health. We also tend to do breast exams, we do pelvic exams, and sometimes it involves some blood work too to check on things like kidney function, liver function, looking at your cholesterol. So we're really trying to take a look at the whole person. That also includes checking in on mood. How are we doing with anxiety, depression, things like that, to make sure that we're really taking the best care of people that we can.
And you mentioned some of those things, like some of that preventative care with screenings. I guess, what advice do you have to women getting ahead of that preventative care? I think a lot of people sometimes maybe put their health on the back burner, but what would some of your advice be?
It can be hard. Women are busy. We have careers and children and lots of other people that we're thinking about. And so sometimes it's hard to think about your own preventative care. I think a big thing is just making that appointment and coming in to see us, because we don't expect you to remember exactly when your last pap smear was, when your last mammogram was. We're happy to help you figure out those things and the intervals at which you need screening. We just really want people to make those appointments and come to see us.
All righty. That's all we got today. I want to thank you so much, Dr. Culotta. Great advice. I appreciate you coming in today.
Thanks for having me.